Hey guys, how are you all? Welcome back to MedSteps YouTube channel. This is episode 13 in our first 8 series, and today's topic is very important, that is avascular necrosis of the femoral head, also known as osteonecrosis. By the end of this video, you will understand what causes of avascular necrosis, how to identify it, why it matters clinically, and how it's managed. So let's dive right in from the basics to the board relevant clinical PLs. Okay. So, avascular necrosis. Avascular necrosis means, or it's also known as osteonecrosis. That means necrosis means death of bone tissue due to lack of blood supply. Lack of blood supply means A means absence, vascular means blood supply. Okay. So, absence of blood supply leads to death of the bone tissue, is known as the avascular necrosis. When blood flow is cut off, the bone cells die, leading to collapse of bone structures and eventually arthritis. Okay. So, this mostly in examination the doctors will ask, because when I done orthopedic department, that time the Dr. Khan, he asked about tell me about avascular necrosis. That time I got some idea, so I told these things. But when they are asking about definition, that time you have to tell like avascular necrosis is ischemic death of bone due to impaired blood flow, commonly affecting the femoral head. Okay. So now we are going to see in first aid book. Yeah, here you can see here avascular necrosis as osteonecrosis is death of segment bone due to loss of blood supply. I already told this thing. The femoral head and neck derive their blood supply from superior and inferior gluteal arteries and medial and lateral femoral circumflex arteries. Okay, if you are seeing here, this is now we are going to discuss about blood supply little. In this blood supply, mostly we have to understand before understanding avascular necrosis, you need to know the blood supply of femoral head, because this is very extremely important for USMLE and FMGE examination patterns. Okay, so they might be asked these questions, so it's very important. The sources of blood supply for femoral head: superior gluteal artery, and next we can see here, that is medial femoral circumflex artery, that means this one. Okay, this artery is most important because the blood supply is providing to posterior aspect of femoral head. Next one, lateral circumflex artery, femoral artery, this one is laterally it's going. Okay, so lateral femoral circumflex artery will be that blood provided on anteriorly. Okay, next we can see some foveal artery. I don't have image that artery picture is. Okay, so next one, femoral artery, not femoral, sorry, foveal artery. In this foveal artery, it's a branch of obturator artery. Okay, now we are discussing about foveal artery. It's a branch of obturator artery. This is the from this branch of obturator artery we will get a foveal artery. So mostly it's that blood we can see in ligamentum of teres, this one. Okay, acetabular branch of obturator artery. Inside, if you are seeing, means you will get foveal artery. So only this is very important in children's. In children, if you have any fracturation happening, means this artery will get tear, and that more amount of bleeding, hematoma, this type of things we can see. Next one, trocentric anastomosis means it forms collateral blood supply. Okay, so this is the blood supply. So next, why is this important? because the medial circumflex femoral artery is the main supplier of and is vulnerable in femoral neck fracture. If any fracture happens in femoral neck, that time this medial femoral circumflex artery will get tear or injure. So, because of that thing, absence of blood supply will happen. Because of avascular, that part will not get any blood. So, that bone tissue will die. Okay. So, that is why femoral neck fracture can lead to avascular necrosis of femoral head. Okay. So, what are the causes? Etiology. What are the causes? Why these things happening means, first one, femoral neck fracture, especially in elderly and with osteoporosis patients. Next one, corticosteroid therapy. In corticosteroid therapy, mostly we can see prednisolone. If over prednisolone consumption, people will get this type of avascular necrosis thing, because it's like corticosteroid therapy, if the patient is using like long term use, it will increase risk of avascular necrosis. Next one, sickle cell disease, microvascular occlusion from sickled RBCs. So, this sickle cell disease also can cause avascular necrosis. Okay. Next one, systemic lupus erythematosus. Systemic lupus erythematosus. In systemic, this autoimmune disease will cause like vasculitis plus like if because of using steroid use. Next one, alcohol abuse. It affects the bone metabolism and blood flow also. Next, trauma and dislocation. If any patient getting like disrupts of vascular supply, that person will get problem with avascular necrosis. And sometimes you can see like a decompression, decompression sickness, and Gaucher's disease, radiation, and transplant patients. Okay. And some hip surgeries, this type of people, acetabular surgeries, these people will get to this type of people, this type of patients can get a vascular necrosis of femoral head. Okay. So, now pathophysiology. This is core pathology is interruption of blood supply to the subchondral bone, which causes like bone cell death, collapse of bone architecture, degeneration of articular cartilage, and progression to osteoarthritis. So, must we have to remember avascular necrosis usually affects subchondral bone first, then after it will spread. Okay. So, because subchondral bone will be like little spongy, so it's the bone tissue is very easily can damage. Understood? Next one, clinical features. If patient coming to us, the patient will come with some clinical features. So, what does the patient feel? If we are asking means, the pain will mention first thing is pain in the groin region, thigh region, and buttocks. Okay. It's that pain will be like the pain is worse with activity, and we can see some limited range of motion. The range of motion will decrease, limited range of motion, and mostly especially in internal rotation and abduction. And we can see joint instability in later stages. Before we will not see this joint things, in later stage we can see this type of things. Next, osteoarthritis and fractures are major complications in avascular necrosis. One important point, one hallmark also for avascular necrosis. If any patient coming to you without trauma, in a young patient on steroids, the patient using steroids, and she is like young patient and no trauma, history of no history of trauma, that time you have to think about avascular necrosis. Okay. Next, we are going to see the imaging. In imaging, first in early stages we can do X-ray, because X-ray may look normal, and MRI if you are doing means is the most sensitive, it shows ischemic changes early. Okay. You can see this X-ray images here. In advanced stage, we will get crescent sign. In this crescent sign, the subchondral lucency if you are seeing this image, the subchondral bone will get cruciate because of femoral head neck fracture and femoral head flattening and or collapsed. You can see this image. Okay. Next one, joint space will get narrow. If you are seeing this here, this femoral head fracture and joint space will get narrow. Okay. X-ray is for bone collapse and MRI is for early detection. This is the main things for avascular necrosis. So, what management we can do? Non-surgical options in early disease like non-weight bearing NSAIDs for pain, bisphosphonates for controversial, cord decompression to improve blood flow. In surgical options, you can select late stage osteotomy, total hip replacement, bone grafting in selective cases. So, finally, for exam tips, I am going to tell little main points. Sickle cell plus hip pain, you have to rule out the avascular necrosis. Steroids plus systemic lupus erythematosus plus bone pain, you have to think avascular necrosis. Trauma fracture near femoral neck, you have to monitor or follow up with avascular necrosis. MRI is the best option for early detection of avascular necrosis. So, alright. So, that is a complete breakdown of avascular necrosis of the femoral head from blood supply to imaging to management. So, I hope this video is help you not just for exams like USMLE and FMGE, but also in clinical practice also. If you found this video helpfully, do not forget to like, share and subscribe to MedSteps, your trusted guide in medical education. Drop a comment if you have any doubts or want me to cover any specific topics. So, please drop one message in comment section. So, we will see you in the next episode, that is episode 14. In that episode 14, we are going to discuss about knee injuries, all knee injuries from first aid guide. Okay. Take care. Bye bye.